Your attention, please. Thank you very much for your kind patience. Now we're going to go to the next session, the weekend field by Dr. Marina Lando. Dr. Porter, could you please start?
So we are going to move to the last session. I will introduce you Dr. Marina Lando. She graduated from Beersheba Medical School Israel in 1985. She accomplished her dermatology residence in Tel Aviv Medical Center in 1990. Dr. Lando had a fellowship in dermatopathology from New York University, New York, 1992, and clinical pharmacology and dermatology from Sunnybrook Hospital, Toronto, Canada, 1995. In the last years, Dr. Lando is specialized in the field of cosmetic dermatology and skin rejuvenation. And in this field, Dr. Lando gained a wide experience lecturing about these subjects in national and international meetings. After working together with the late Dr. Yoram Finti, Dr. Lando keeps developing a new peeling method. Exfoderm peel and vegan peel became world-known brand for skin rejuvenation. Dr. Lando is a member of the American Academy of Dermatology, and she is currently a secretary of Israel Society for Dermatologic Surgery. Dr. Lando published more than 50 scientific articles in the leading dermatologic journals.
So good afternoon to everybody. Today we're going to present weekend peel, which is a novel medium depth peel with a lot of advantages over other peeling methods. My weekend peel is a medical peel, and it's based on a unique combination of chemicals and natural components. And the main indication for weekend peel are mildly sun-damaged skin, superficial wrinkles, acne scars, and all the pigmentary problems of the skin. I think that we can move now here. This is the weekend peel kit. This kit contains treatments for 3 different patients, and the kit is composed of 2 bottles and the powder. The first bottle is solution A, then we have solution B and the powder. And if we can go back here to the computer. The solution A is composed of these 4 different acids: the lactic acid, undecilic acid, resorcinol, and salicylic acid. It's similar to Gessner, but has different percentages from the Gessner, and has also undecilic acid, which is very useful for acne. Next slide. The coralline sponge, this is the plant sponge, is enriched with silica, calcium carbonate, calcium oxide, disodium oxide, and algae. And it is activated by solution B, which contains Dead Sea salts and aloe vera extract and witch hazel extract. We mix the powder with solution B together to start the activation. Next slide, please. So now we'll see the procedure. Basically, the procedure starts with cleaning of the face. We usually use, after washing the face with water and soap, we degrease it, defed the skin using regular acetone. Then we rub the skin with the solution A. We'll see the procedure. Next slide, please. Then we prepare the powder with the solution B and apply this muddy mixture on the face, on the skin, and rub it in for 5 minutes. Next slide. Then we wash the face and reapply a solution A using Q-tip and we call it a sandwich technique because we use solution A, the powder, and solution A again. Next slide, next slide, next slide, please. Okay, immediately after the peel, there is going to be slight erythema, slight redness, and usually a spontaneous peeling of the skin will start on the 3rd day. You can see here in how the skin peels spontaneously. Yes, next slide. And we'll see some clinical pictures, the before and after. You see this patient with bad lentigo, and this is how her skin looks afterwards. Another example for skin rejuvenation. Again, a patient with this is a patient with acne. Another patient, dark skin, acne. Another patient with melasma, dark skin patient. Another patient with melasma, skin rejuvenation. Again, spots, bad skin quality. And again, lentigo. The same again. Skin rejuvenation. So why to use weekend peel? There are a lot of different peels, and there are a few reasons. First of all, because it's extremely safe. It's a medium peel, but you cannot induce any scars. For example, as sometimes happens with trichloroacetic acid peel. Weekend peel has very short course. It takes about 3 days until the peeling completes. No sedation is required because the procedure does not create any burning, maybe very, very mild burning. One session only needed, and it can be performed not only on the facial skin, but also on the neck, décolleté, and the hand skin. And we always can combine it with other procedures, such as, for example, in this case, this patient has been peeled by weekend peel on all of her face, and by exoderm, which is a deep peel, only in perioral area because she had some wrinkles over there. And if you can see, this is a perioral, her upper lip has been peeled with a deeper peel. So it's a combination treatment. In this case, for example, this patient has been peeled by weekend peel. At the end of the session, we injected botulinum toxin periorbitally, and after she finishes to peel, which was like 4 days, she sees the nice skin and elimination of periorbital wrinkles due to botulinum toxin effect, start of botulinum toxin. Now we are going to our patient. My friend is going to perform a weekend peel on her. Can we see this? I have the pictures and show the. It shows better. Okay, this is our patient. I think that you can better see from the photos her skin problems. She's 54-year-old lady with premature skin aging, a lot of sun damage. You can see it here. And she is actually an ideal patient for weekend peel. Thank you. Now we will start the procedure by cleaning the face. It is very important to defed the skin and the peeling. So the acetone will remove all the fat from her skin, and it is a very important step in your peeling success. If you don't defed the skin effectively, you will not have an even penetration of the peeling solution. It is important to use a regular acetone. The indication that we did a good job is that the pad is clean. This patient, I asked her to avoid using any cosmetics, any creams for 1 day before the procedure and to wash her skin with the soap. So now by cleaning her face with acetone, we can see that her skin is completely clean. If the gauze is not clean, we should repeat the cleaning, the defetting. So the first stage, can I have glass, please? The first stage is going to be the application of solution A. So this is the solution A. And we need about 1/3 of this bottle. This bottle is for 3 procedures. It has a little bit yellow color.
How is the smell?
You can smell it. Not too bad, not too nice.
Yeah, not too bad.
So I always suggest that the first stage is going to be performed by rubbing the skin. I just put it over your finger. I'm usually doing it like this. Then we can have enough solution. Same, thank you. Now dip it, yes. Just rub it in. It's very important to work systematically. Just rub it in like this. To work systematically, not to create skip areas. We just cover all the cosmetic units. It is an office procedure. Really don't need operating theater for this procedure. It can be performed completely safely in the clinic. At this stage, patient can feel a little bit of burning. You're okay? Does she feel anything? Any burning?
どうですか？痛みはありますか？
Yeah.
She doesn't have any
Okay, good.
pain.
For those who have any experience with TCA pill, trichloroacetic acid pill, notice that at this stage usually our patients already complete of kind of burning sensation.
Can it be done on the upper eyelid?
I don't recommend to use this pill on the upper eyelid. For ectoderm, for example, I will tell meanwhile a few words about ectoderm. Ectoderm is a deep pill. I just got a presentation yesterday. You can continue when ectoderm is a deep pill which should be performed in the operating theater. This treatment can be applied also over the upper and lower eyelid, and we can create what we call non-surgical blepharoplasty. It will contract a little bit the aging skin, and you will have some rejuvenating effect on the eyelids as well. For weekend pill, we do not expect any skin contraction, so we don't need actually to apply it on the upper eyelid. As I showed previously in the presentation, after we accomplish the weekend pill, it is possible, for example, to perform regional treatments by ectoderm, for example, in cases with wrinkles on the upper lip. If we want to improve the wrinkles, we can use ectoderm for the upper lip at the end of the weekend procedure. Yes. Can you show it here? So at this stage already you can see very mild frosting. Frosting is this whitening, spotty whitening of the face. It is usually burning in the places that we have frosting. Frosting it's expression of protein skin coagulation, which will start the peeling process later on. So now we will keep it for the last stage. And now we are going to prepare the solution B.
痛みはどうですか？
はい。
痛みは何か感じますか？
ヒリヒリしない？
Does she have any burning?
熱い。
The cheek is a little bit hot.
Little, yeah, especially in this here.
少し熱い。
Okay, this is usually what patients feel. This is why this procedure is not traumatic for patients and they like it very much. So now we prepare the powder. This is, as I mentioned before, 3 patients' kit. So we have three sackets with this dermosponge powder.
目つむってたね。
So this is actually a natural components, not a chemical one. I just empty it here. And I prepare this, I activate, this is solution B is powder activator. And I would like you to see, can you see it here? I'm just preparing, I'm putting small amounts
手が邪魔なんです。
大丈夫。
and just mix it together.
ずっと目をつむってて。
はい。
And you see it starts to bubble. You see small bubbles here. This is an activation process. Okay, now we can use it. I just put it. Put it all over the face. Start the walking and then we continue. Okay, we can start rubbing it. We just rub it in. We just rub it. The wet cotton, please. Yeah, we prepare. Okay.
これなんだっけ？
視界の塩。
塩？視界の塩？
The idea is to rub this this dermal sponge slowly into the skin. It usually stinges the skin a little bit. And our patient is an ideal patient here. We keep rubbing the skin approximately for 5 minutes. In my office, the procedure is performed actually by nurse. I select the patients and I prepare the patient, and it's performed by nurse under my supervision. I don't know how it's in Japan, if it's possible, but it's actually the procedure is a simple one. After you do the right selection of the patient, you prepare the patient, you can definitely a nurse can do it for you.
How often can we repeat this procedure?
Usually we do it once a year.
Once a year.
I recommend my patient to peel the skin once a year. It's healthy for skin to be peeled once a year. It's important in skin rejuvenation to renew all the process. You know, normally our epidermis, for example, the cells are completely replaced in 28 days. 1 month, every month, all the cells in the epidermis move from the basal layer and peels off. With aging, this process slows down, so we don't have such an efficient a natural peeling of the skin. This is the age when we want to encourage this peeling process. I do recommend my patient to use some home products to enhance this natural peeling of the skin, and at least 1 year to perform a more aggressive, like let's say, medical procedure. It will keep your skin nice for a long time. We have some more left here. You see already this whitening of the skin all over. And it's very important to see that we have a homogeneous reaction of the skin, and we can repeat it in the areas in which we have less effect. We can also rub a little bit more vigorously in the more affected areas because our patient had more spots on her cheeks. So I will rub it here in this area a little bit more vigorously.
今はいかがですか？
はい。
痛いですか？
いや、痛いというよりどないやろ。
熱い。
I gave our patient 30 drops of tramadol. Tramadol, it's painkiller medication, and I use it a lot in my practice as a preparation for weekend pill. I give it to my patient after exoderm pill. They take it for the first 2 days at home, so they actually don't experience any pain. It is a good medication for small cosmetic procedures. Okay, now we'll wait a few minutes and then we'll wash the patient's face. In the office, usually at this stage, I will ask my patient to stand up, to go and to wash her face in tap water. Here, we'll ask nurses to bring us a bowl of water and we just clean her face here. Can they? I don't think that's bad. Just bring us a bowl of water and some towel and we just clean her skin. Of course, we could do the procedure also on our patient's neck, décolleté line, the chest, hands of the hands, and we'll have a very nice result and very nice skin rejuvenation.
How about her hand? Is it a good candidate for that?
Yeah, we can improve her hands, definitely. Yes.
If she had a weekend peel, how long she can't touch the water?
Water, she can watch. Water is not a problem after this pill. On the contrary, my instruction, post-pill instruction for the patients are to wash the face or whatever we peeled with water and soap as much times as they can during the next 2 days after the peel, because it will dry the skin more quickly and the spontaneous peel will start more quickly. Our purpose is to minimize the downtime after the peel so our patients can resume all their daily activities as soon as possible. Thank you. And so I ask them to wash the skin. You know, water dries the skin. So if we wash the skin during the next days after the peel, it will peel more quickly. So water is never a problem after we can peel. Just put it on. Yes. Okay. So we just clean her face. How do you feel, Saiko? Saiko, are you okay?
どうですか？
はい。
はい。
あ、気持ちいいです。
気持ちいい。
Comfortable. Comfortable. Okay, good. Excellent. So you see the difference
弾
in
いてたより楽ですね。全然楽。
お薬をね、
え
入れたから。
Do you need dry towel?
No, no, it's okay. I just want. Can you raise the head, for example?
え。もう終わります。
まだちょっと上げていただけますか？
はい。
もうちょっと上げていただけますか？
Thank you very much.
はい。
もう一回液を塗りますから、
Okay,
目をつぶ
now
って
you can see the difference between the areas that I rubbed more vigorously and the areas that we did not rub so vigorously. You see that here we have more whiteness, and we also the skin is a little bit less, has a little bit less of leathery feeling. It's a little bit harder. It's a little bit swollen already. Now we have two options. If we want to achieve a little bit deeper peel, we will redo a stage 1 again. We will reapply solution A. If we want to have more superficial peel, we can finish the peel at this stage. I think it will show the whole process. So the third stage, we will use the same solution A that we put, but we are not going to rub it anymore with gauze, but we'll use the Q-tip. Those are very good Q-tips. For example, these Q-tips are too hard. They will not absorb a nice amount of the solution. This one are much better. Again, working systematically is important.
今の痛みはどうですか？
はい。
今痛みは感じますか？
痛みって
熱い？
At this stage, a patient might feel again some burning sensation.
ぐらい。
ヒリヒリ？
いや、ヒリヒリじゃなくてヒリぐらい。
ヒリぐらい。So you have very, very mild
Burning
burning
sensation.
sensation, but very mild.
So we can hear a ventilator. We can assist our patients, but usually it's
Oh, she can take.
yeah. Usually it is very. It's the burning sensation is very mild. There are always differences between the different patients. Some patients are more sensitive to this pain. The other patients are more resistant to this kind. But it's usually a very mild inconvenience by doing this peel. You can reapply few layers. You can. It's not a problem. It's not a TCA, so it's very safe to reapply the solution again. We will wait few seconds, few minutes, and then we'll see whether the penetration is homogeneous. Meanwhile, can we go back to the presentation, to the computer? What does it say? Close it. Can you reopen it? Okay. Never mind. Meanwhile, we're trying to restart our presentation. The post-pill course. The post-pill course is going. We will wait few minutes. The bleaching, yes, thank you. The bleaching, the whitening will go away. So when the patient finishes the procedure, her skin is going to be a little bit erythematous, a little bit very mild redness. So actually after the procedure, a patient leaves the office very human look, nothing very extraordinary. At the same day, she even can go out. Usually after 12 hours, the skin will become redder, more red, and even red-brown. It becomes like a little bit brownish. So usually the next day, a patient stays at home, and this color remains for the next 2 days. At this stage, as I mentioned before, I advise my patient to wash the skin, to use a lot of water, soap, so it will dry the skin, and then a peeling process will start. A peeling is very short. It takes about 1 to 2 days until all the peeling finishes. It is a spontaneous peeling. I ask my patient not to help this process, to let it finish spontaneously. Starting from the 3rd day, I give all my patients post-peel cream, especially important for dark skin patients, but it's important to everybody. It contains, it's kind of a Kligman preparation, contains retin A, hydroquinone, a little bit of dexamethasone, cortisone, and vitamin C. At this stage, it is important because it enhances the peeling. It makes the peeling process shorter, and in the moment the peeling process completes, it is important to keep the skin nice and to avoid any hyperpigmentation. And then keep it doing for once daily, at night time, for the next 4 weeks, let's say so. For 4 weeks they use once a day. I always explain my patient that it's not a moisturizer, so they need to use very small quantities of this cream, and to keep doing it for 4 weeks. I advise my patients, actually without any connection to any pill, to use this Kligman preparation at least 3 times a week to keep the skin. We live in Israel, the skin phototypes are very similar to Far East. We are Mediterranean. Most of our population are type 3 and 4. So we have basically the same problems of the skin, a lot of spots, a lot of skin aging. It is important to keep the skin nice. It's important to treat, or to treat prophylactically even. So, but definitely after any kind of pill, I keep my patient for at least 4 weeks on this Kligman preparation, and that's it. And after the peeling process complete, they can regain using all the normal cosmetics. They have a little bit of redness that will go away very quickly, but they can go out using the usual cosmetics, some makeup camouflage to conceal the redness, but the redness is going to be very mild, much milder than what we see here. So can we just shortly go to the presentation? So this is how the patient is going to look after 2 days. You see this, how the spontaneous peeling starts, and you see this mild redness. This is how her skin is going to look after 3 days. And that's it.
I think there are many questions on the floor, so
We are going to take the questions here.
yeah, we can take a question here.
Okay, no problem.
So if you have any question, please come to the mic and please ask the questions.
Dr. Anandao,
Yes?
you mentioned that you're going to repeat the whole procedure again. How come you didn't apply the drubbing?
I said two things. The procedure has 3 steps: solution A, the powder, the solution B, and solution A again. When we did the first time, the solution A has been applied using sponge, on the finger. It's a little bit rubbing of the skin. The second time, we applied solution A using a regular Q-tip. Another thing that I mentioned, that this procedure can be repeated every year to keep the skin nice and clear, and to treat this small lentigo that usually reappears in patients with solar damage.
My question is, can you apply the rubbing solution again after you apply the solution A?
When do I apply it? After
Can you repeat it again? I mean, the whole thing.
Yes, we repeated it just when we treated as psycho. I reapplied solution A. After we washed the face, we reapplied solution A again.
No, my question is, can you apply solution B mixture again?
Solution B.
Yeah.
Well, theoretically you can, but solution B comes with the powder. So you ask whether we can re-rub the powder in. Well, basically you can. I think that the only reason to do it, if you don't achieve this nice effect that we can see here on Psycho's face, if you don't achieve this reaction, redo stage 2 again. Otherwise, if you have this nice reaction, you do not have any indications to repeat step 2 again.
Thank you.
I think that there's a misconception sometimes that if you redo medium depth peel twice or 3 times, you will achieve the effect of deep peel. And it is a misconception, because the materials, the agents that we use for medium depth peels do not penetrate the skin to the levels which are treated by deep peel. So if you repeat the same peel again and again, a medium peel, and you still do not achieve the levels of the deep pathology, mid-reticular dermis. This is the main pathology of wrinkles, for example. It's a damage to collagen in mid-reticular dermis. By performing twice or 3 times medium depth peel, you do not reach these depths. So you will never get the results that you will have from a deep peel. So if you have a patient who needs a deep peel, don't do on her medium depth peel twice, because you will never get results of deep peel, and yet you will expose your patients of a potential complication from medium depth peel.
Marina,
Yes.
after 72 hours, do you use corticoid cream? When you use corticoid cream?
Usually I do not use corticoid cream after any peel. I use Kligman preparation. You know that Kligman preparation has 0.5% of hydrocortisone or dexamethasone. It is a very low concentration of corticoids. It is not there because to get the corticoid cream effect. It is there only to neutralize a little bit the potential irritation that you can get from retinoid, from retin A. 0.5% hydrocortisone cream is very, very mild. It is part of Kligman preparation. Otherwise, I do not use any corticoid preparation after any of my pills. Any other questions?
Marina, can
Yeah.
you tell me how frequent do you repeat the procedures? Once a month, or twice a month, or every 3 months, something? Thank you.
It's Dr. David, right, from Indonesia.
Yes.
Well, usually I repeat this procedure once a year. Some of my patients have ongoing results after 2 years and after 3 years, so I repeat it according to the need seen by the skin. And there are always individual differences of how long the results will last, and it always depends also of how the patients take care of their skin. If they use sunblocks, for example, so the results will remain for a longer time. If they do not use sunblock and they go to beach and have some suntan, so the results will disappear shortly. There is no problem, at least theoretically, to perform this pill every month. But usually there is no need. The average results will continue for at least 1 year. Any more questions, please?
Still, Dr. David, I have another question.
Okay.
By repeating, for example, every 3 months, can you achieve even better or more improvement of the skin? Thank you.
I tell you, my general philosophy is that if you don't have a need to do a procedure, don't do it. I mean, if we'll have a nice result, the patient is happy, the doctor is happy, I don't really see any sense to repeat the procedure in 3 months. But if the results are starting to disappear and the patient comes in and she wants another pill, and you know, you can see any kind of pathology that can be corrected by the pill, you can definitely repeat the pill after 3 months. Yes, please. Any more questions?
Any question from the audience? If you'd like to ask questions to Dr. Nando, please come to the hall 1 so that you can ask questions to Dr. Nando.
So if the patient were to have the weekend peel on the hand, can she use the hand to cook?
Yes, she can do everything. She should know that for the next few days, the skin is going to look a little bit ugly, but no problems. Well, I will not advise her to work with any detergents, for example, not to irritate the skin, but no problem with water. She can wash her hands, wash the face. For regular work, no problem. Can you open your eyes?
No.
You want to sit down so we can see the skin? Okay. Okay. Just look at the camera, please. Can you look here? Just a moment. So you see our patient. The frosting is almost gone. You see a little bit of redness here. You can look at yourself also. So in this condition, she actually can leave the clinic, and she does not look like a monster. But tomorrow or tonight even, her skin will turn more reddish brownish. So she might want to stay at home for the next 3 days. How are you? Okay? Okay. Thank you very much. I want to thank you also.
Thank you.